We are the South-Southwest Mental Health Technology Transfer Center, which you can see on the purple center of this map. We have quite a few different mental health technology transfer centers across the country. And with that, I would love to go into the actual introduction of our presenters here today, Geeta Enders, Rita Kronies, and Jonathan Edwards. And give me a moment to read you all of the amazing things. Jonathan Edwards serves as Acting Director for the Overdose Education and Naloxone Distribution Unit with the New York City Department of Mental Health and Mental Hygiene, Bureau of Alcohol and Drug Use Prevention, Care and Treatment, and also consults nationally, advancing peer support workforce development, including supervision and certification in mental health and substance use treatment settings. He is former director of peer support services at Kings County Hospital Center in Brooklyn, New York, where he supervised nearly 30 peer specialists working across 5 different service settings and developed and facilitated support groups for family members. Jonathan received his Master's of Philosophy and PhD in Social Welfare from CUNY Graduate Center and his Master's in Social Work from Silberman School of Social Work at Hunter College. Man, that's a lot. Jonathan is so impressive and is also a licensed clinical social worker. He is also an adjunct professor at Columbia School of Social Work, a member of the Academy of Certified Social Workers, a New York certified peer specialist, and a certified personal medicine coach. Jonathan served on the National Association of Peer Supporters Board for 4 years, New York Peer Specialist Certification Board since 2014, and Mental Health News Education Board since 2012. Jonathan identifies as a person in long-term recovery, which is the driving force behind his worldview, advocacy, scholarship, and professional direction. Dr. Edwards' research explores factors associated with job satisfaction among peer support workers in mental health treatment and recovery-oriented service settings. Geeta Enders currently holds the position of director in the New York City Health and Hospitals Office of Behavioral Health, where she oversees numerous healthcare delivery system activities and concerns impacting individuals who use mental health, substance use, and co-occurring treatment services, and provides oversight to the New York City H&H Peer Academy. Prior to joining New York City H&H, Geeta provided services ranging from board membership to directing training at peer-run organizations in Arizona. She presents locally and nationally on programming and supervision, and Geeta is a licensed master social worker. She has a master's degree in English with creative writing, a bachelor's degree in psychology, and is a certified psychiatric rehabilitation practitioner, as well as a New York State certified peer specialist. She serves as supervisor to the peer advisor program as part of the Public Psychiatry Fellowship of Columbia University and New York State Psychiatric Institute. Rita Kronies is an instructional designer with lived experience of a major mental health diagnosis. She is an advanced level RAP facilitator, certified as a peer specialist and peer specialist trainer in the VA, and led the development of a SAMHSA-funded Recovery to Practice Advanced Peer Specialist Training. For 2 years, Rita served as the Acting Director of Operations at the National Association of Peer Supporters, where she coordinated the consensus process among 1,000 working peer specialists across the US that led to 98% agreement on national practice guidelines for the peer workforce. Rita currently holds a faculty position at Rutgers University as the lead instructional designer on the Online Academy of Peer Services, which is the training and testing component of the New York State Peer Specialist certification. She is also the coordinator of the companion virtual community of practice that serves as a bridge between online learning in the Academy of Peer Services and real world practice. Rita continues to serve on a national work group with NAPS on developing guidance for the supervision of peer specialists and other peer support workforce issues. She is a frequent lecturer on peer support values, practice, and supervision. And with that, I want to give a huge welcome to our presenters and invite them to turn on their cameras so that we can all welcome them. Thank
I
you
just
all.
want to mention too that I'm not the only one on that national practice work group. Gita and Jonathan are both on that work group, so all three of us are part of the NAPS work group.
All right. And here is where I will pass it off to you.
So good afternoon, everyone. This is Jonathan Edwards from New York City. My pronouns are he, him, and his. And as I've learned from you all, anyone who may have visual abilities that are different than mine, I am a black man, bald. I'm wearing a black shirt, and I am medium brown complexion, and I am stocky, and I am very grateful to be here. And I'm going to pass it to Rita to do her brief introduction, and then I will pass it to Gita, and then Rita will start us out with who's in the room.
Thank you, Jonathan. So I'm Rita Cronice, and for those with visual differences, I am a I'm a crone. You might mention I am elderly and I have gray hair, and I'm a white woman in my 60s, and I'm delighted to be here. And Gita.
Good afternoon, everyone. My name is Gita Enders. As you heard the bio from Jesse, thank you. For the visually impaired, I am also an older adult, Caucasian female with white hair. I'm smaller than most people, and I'm wearing a blue sweater. So thank you very much for coming. And we'll let Rita start us off with who's in the room.
Great. So we like to call this our roll call. So we want to see who's in the room as far as what your role is. And beyond using the poll, you can also add more information in the chat. I know many of you have already mentioned in the chat, but Jennifer, if you can launch the poll, just tell us really quickly whether you're a supervisor, a peer support worker, a service recipient, a family member, a non-peer provider, or something completely different. Just pick the one that calls to you. If you're more than one, pick the one that calls to you most strongly in the moment. And let's give it, say, 20 seconds or so for people to respond. And in addition to the poll, thank you, Gordon. If you all could add to the chat just where you're located and what you do, who you serve, that would be great if you haven't already. Okay, Jennifer, let's see who we've got in the room.
I ended the poll. Are you able to see the results? I'm sharing them now for you, Rita.
Okay, yes, we can. I see that we've got about 60% supervisors, about 20% peer support workers, about 3% who are service recipients, and 17 that probably are a combination of one or more, two or more of those. So thank you. It gives us a sense that we've got quite a few supervisors in the room. So thank you. Next slide. And so we'd like to really start out with something very interactive. And this is just what we like to call describe your favorite supervisor. And looks like we have about 37 people in the room. So why don't we split into 13 breakout rooms? And before we split to the breakout rooms, what we'd like you to do is take about 1 minute each in the room. You'll either have one other person in the room or two other people in the room to just very briefly describe your favorite supervisor, past, present, or and why they're your favorite. So just talk a little bit about your favorite supervisor, why they're your favorite, and what we're looking for are themes about what it is that makes people a favorite supervisor. Okay, well, I know that was a very quick amount of time to try to talk about your favorite supervisor. I'm sure many of you could have talked for a very long time. And what we'd like you to do is just in the chat, if you can think of, between the 2 or 3 of you, common themes that came up about what it was that made your favorite supervisor. That's kind of where we're going with this. We want to talk about really good supervision as we move forward. So we can go ahead and put information in the chat, and we'll move forward with the survey, and with the presentation, and we'll likely loop back to this and refer to it towards the end.
Oh, Christopher, I had to micromanage somebody today. They went rogue. It was not a peer.
I am so sorry to hear that. But that's like my pet peeve. I hate someone to just put their thumb on my back. You hired me, give me the opportunity to show you I can do it, train me to do it, and then allow me to do it, or maybe find somebody else. But I just feel like if you gave me this position, let me do it until I'm not doing it right.
Okay, and I think with that, as you guys are going ahead and adding to the chat, if we could move forward with the slides, we'll move on to the next section, and we'll come back to the common themes a little bit later.
Okay, thanks, Rita. And I just really want to give a shout out to my colleague, Rita and Gita, and Rita in particular, for being able to facilitate a breakout room in record time and actually come out with some substance in the chat. So Rita, hats off to you again. So why supervision? And, the majority of attendees today identify as supervisors in your professional role. So we're talking about supervision largely because, there's an emerging peer workforce in the United States and internationally. So one of the recent studies or resources estimates that the number of certified peer specialists nationally is approximately 25,000. And if you notice, that's certified peer specialists. Many people work in the role of peer specialists. Some people are veteran social workers, as well as not social workers, veteran peer specialists, as well as peer specialists who may even work for the Veterans Administration. And we have peer specialists who work in non-Medicaid billing settings. So the certification may not be as much of a need or an issue. So we can certainly estimate that the number of peer specialists altogether, in addition to certified peer specialists, would be a much greater number. And so with this ever emerging workforce in the United States, it really necessitates having supervisors, having supervision, having a supervisory structure. And along with that is an uptake in organizational interest and buy-in of peer support staff, both in mental health and substance use disorder programs, among many other programs. And then, of course, we find that in the human services, there's a historical underutilization of established models that guide supervisory practice. And Rita's going to talk a little bit later about the National Practice Guidelines, which we subsequently developed into National Practice Guidelines for supervisors. And so we are proposing, or we have proposed, a model to really guide supervisory practice. And so these are three of the real reasons why we're talking about what we're talking about today. Next slide, please. So our learning objectives are that by the end of this workshop, you will be able to identify the 5 critical functions of supervision, provide examples of how to use the 5 critical functions of supervision in practice, and third, describe how the 5 critical functions of supervision and the National Practice Guidelines can be used as a supervisory self-assessment to enhance interactions with peer specialists. Next slide, please.
So when people think of supervision, they sometimes go to administration. And that is not what supervision is. It is not counting the number of clients, the case, they shouldn't even use the term caseload. It is not counting the number of forms. It is not counting the number of cases managed. supervision has many layered elements that Jonathan will go on to introduce later in the presentation. Next slide, please. So when we think of supervision in human services, it is a structured relationship to share with the individual the attitudes, skills, and knowledge needed to be a responsible and effective worker. Supervision models are rooted in the development of social work and casework, but what we share in common with those domains is concern for the needs of the participants that we assist. And effective supervision encompasses the 5 critical functions: administrative, supportive, educative, advocacy, and evaluative functions. Next slide, please. So the relationship. Supervision represents an alliance between 2 individuals. Their roles may differ, but they are working towards a common goal. Teamwork, communication, mutual respect, and especially professional development are paramount in the supervisory partnership. Next slide. Rita, want to take us into the national practice guidelines?
Certainly. So I had the distinct pleasure to be working with the National Association of Peer Supporters at the time that we started developing the national practice guidelines. That was in 2012. It came out of the national conference in Philadelphia in 2012. There was a big groundswell of people that were just really looking for guidance that wasn't really in the field. There was a lot of guidance saying what peer specialists could not do, should not do, never should do. A lot of the thou shalt nots, but not a lot of the thou shalt kinds of guidance. So what we did was we combed the literature for the best guidance that we could find. And it really came out of the consumer operated services providers, and it came out of the trauma-informed literature that we found the best initial guidelines that we worked with. We then, Steve Harrington, who was the executive director of NAPS at the time, worked with that and developed not just, if you could go to the next slide, I'll show you a little bit about what the guidelines look like. So we came up with 12 core values. We actually started with 10, we went to 12. We went through a meeting at SAMHSA and worked with the substance use community to make sure that it worked both for mental health and substance use, peer support, and peer recovery advocates. And these were kind of the core values. Each of these core values has a longer definition that goes with it. But what Steve did was he then took out of a lot of the practice that he had worked with many people on, and we had done a number of focus groups around the country, and developed what the guidelines would be. So what each one of these core values look like in practice are the actual guidelines. Those were issued in 2013 after we did sort of an extensive series of focus groups, and then we did a survey, and we had 1,000 people that said, yes, we agree, these are practice guidelines, you know, that really capture the essence of what peer support is. So we had 98.8% agreement to the practice guidelines at that point in time. We issued them in 2013, and following that, we started seeing a lot of reports coming from the peer support community through NAPS and other venues where supervision was really not in alignment with these values and wasn't allowing people to practice in alignment with these values. So a work group came together, and Jonathan was a very instrumental part of that work group. But we said, okay, so let's take each of these practice guidelines and say, what's the role of the supervisor in helping to ensure that peer specialists can actually uphold these values, can live up to those values? And so after almost, I think it was, 18 months that we worked on that, Jonathan, we finally came out with, we launched the National Practice Guidelines for Peer Specialists and Supervisors, which added a whole column within the guidelines on what's the role of the supervisor in helping peers to uphold these values. So that's a little bit about the core values. And I really encourage you, when you get this presentation, you'll see that there's a link here to the National Practice Guidelines on this slide and the last slide of the presentation. If you haven't looked at them, take a look at them. And if you haven't I gave a more extensive talk about this in the previous part 1 of this series. So you can go back and look at that as well. So with that, I'll hand it off to, is it to you, Jonathan?
Yes, it is. Okay, and I was hoping that the ambulance in the background would pass by entirely before I came off mute, but we'll do the best we can. So this next slide here, I always call this the pretty slide because it doesn't have much function, even though it is about functions, ironically. It is to sort of give an overview in a diagram format of the 5 critical functions of supervision that we're going to be talking about. Just a little point in history, this actually started out as a 4-function model when I first sort of came up with it as a self-assessment and accountability tool in 2010, at the time that I was supervising the 30 peer specialists in a large New York City hospital. And then subsequently, a very dear colleague of mine, Yumiko Ipta, suggested that we add advocacy or advocate to this model to really capture some of the unique considerations that we take into account when providing supervision, in this case, to peer support specialists. So we have the 5 functions, which are administrate, support, educate, advocate, and evaluate. And these are not in order of importance. It's just how we have spelt them out. And we'll now sort of give you some examples of what each of these functions entail. So can we go to the next slide, please? So I always begin by saying that, you know, and we had this as a poll question once, when does supervision begin? And some people would say, well, when we start to go over the job description, or when there's a problem and the person gets in trouble, or when we want to give someone a compliment, or when they exceed our expectations. But, you know, in all seriousness, supervision really begins, I think, when we're looking at who is going to be the right fit for the job. We may not be offering supervision, but we're taking on a supervisory responsibility, identifying a candidate from the workforce that's going to be a fit with the work and vice versa. So that really begins with hiring staff who meet the job qualifications, orienting staff to the organizational structure. So before we even get to the work, there's policies and procedures, there's organizational culture, there's the structure, there's requirements. As you know, Gita said in the very beginning, is that, you know, people automatically go to like the administrative function, and that's just one of the many functions of supervision, but it's usually not one that we talk about in the context of supervision. And as I also said, it's helping staff to understand the practices, the policies, and the procedures. And this is across the board. So yes, we're talking about supervision of peer support specialists, but we contend that this administrative function is not unique to peer specialists, but this is a supervision model. So the next one we're going to talk about is support. And support entails building rapport by providing constructive feedback, inspiring excellence and promoting wellness and self-care. We also like to qualify that that's wellness and self-care for all staff. We've heard examples about supervisors suggesting to peer support specialists that they develop a RAP plan. Well, that's actually discriminatory, and it's stigmatizing if you're not asking all staff, because if you're promoting a culture of wellness, that's wellness for everyone, not just some. And of course, utilizing a strengths-based and trauma-informed approach to help staff to problem solve. Educate. So education is around explaining the big picture, providing context and value of specific roles in supporting the mission. Also, it entails coaching staff on methods for engaging and educating participants around choices, goals, benefits, successes, identified areas of challenge, by the person, and offering relevant training and conference attendance opportunities. So we're going to sort of qualify the offer and say we're promoting relevant training and conference attendance opportunities, because oftentimes as supervisors, we want to be able to offer things to our staff, but there may be some administrative constraints as to why we can't. So we don't want to be misleading. We like to promote that a person may benefit from a particular type of training. And that sort of naturally goes into advocating, as we advocate for these individuals. We advocate by fostering good morale and a respectful work environment. We advocate by strengthening the practice of peer support by promoting its value. And in order to promote its value, we need to know about its value and what it is. And that really speaks to what Rita just went over in the National Practice Guidelines, to really understand what those key values are that get parsed out in practice and in supervision. And then lastly, to negotiate reasonable work accommodations when appropriate. And this could mean so many very different things. Negotiate is around having a discussion. It's around trying to further the fit between the person and the job, but also to maximize the value add to the job and to the environment in which the peer specialist is working. And lastly, but not least, is evaluate. And oftentimes people say, oh yeah, now we're going to talk about performance evaluations. But performance evaluation is sort of like, it's like a symptom of performance, because it's not, it's one way of evaluating what goes on in a person's day-to-day activities. It's one of the ways of evaluating outcomes, but it's so much more. And it really begins with communicating and helping to manage expectations with respect to job performance. So setting reasonable goals, prioritizing, escalating, communicating. Gita and I have another workshop, managing across, because this managing up, we're moving away from hierarchy and we're moving more toward partnership. Conducting performance evaluations is part of evaluation, but it's not all of it. And then addressing areas that need improvement, that could be a tremendously empowering process, because another thing that Gita says is we have a praise sandwich. So when someone comes in for supervision, we could begin by identifying something that the person does really well. And then we can, sort of talk about something that could use some improvement. And then we end with something that's very positive to affirm the person. So progressive discipline or, performance assessment does not need to be punitive. It doesn't need to be disrespectful. And I always use the case of someone coming in and we say, we noticed that you are really, you document really well. And this is just an example because I know a lot of peers don't document. So don't hang me for using this example. So it's like, you document really, really well. We noticed that there was some follow-up resources that you talked about. I didn't see those in the notes, but you're really good at follow-up. So I really appreciate you adding that into the note. And once again, this could be a conversation with any person you're supervising. So I just wanted to give that example of how to give something positive, how to address something that needs improvement, and how to end on a note that encourages the person. So although not exhaustive, this matrix that we're looking at does include 5 functions, and these are some of the many examples and which we call competencies that are required to do a very good job and to sort of be able to break things down into categories. Next slide, please. So,
I was muted.
yes, go ahead, Gita.
It's tradition that I explain the activity. We're going to have a little bit of a longer breakout preceded by a demonstration. After a volunteer, we're going to show some supervision situations, things that might arise in supervisory practice. And after someone reads the supervision situation, participants will utilize the 5 critical functions of supervision. We're going to put the matrix back up on the screen to respond to the question that follows the situation. And the 5 critical functions of supervision in practice, as you saw, provides examples of each function that we can use to inform our responses to the situations. So for the first situation, we're going to, Jonathan and I will model the situation for you to give you an idea of what kind of dialogue you might want to have in the breakouts. So next slide, please. And I'm going to ask a volunteer to unmute and read this situation for us. Do we have a volunteer?
Sarah Goodman.
I volunteer Sarah Goodman.
I was just going to raise my hand. Gives me purpose in life. Thank you. Timothy is a peer navigator with a well-known community-based organization. Dolores, one of the people he supports, overheard Timothy talking about the wonderful and enlightening church service he attended last week. Seeking to find a church family and wanting a sense of belonging, Dolores approached Timothy to ask if she could attend service with him on the following Sunday. Unsure of how to respond, Timothy asks Dolores if he could get back to her and then contacts his supervisor to discuss the matter. Using one or more of the examples of the critical functions of supervision in practice, how might you, as Timothy's supervisor, consult with him around this issue?
I will take the role of Timothy.
And I will take the role of Dolores.
Okay.
Yes.
No, you will not. You will take the role of my supervisor.
Yes.
We are gender non-specific. So are these situations.
So your supervisor will be, I'll just use Jonathan to keep it simple.
And you can call me Gita.
Okay.
Jonathan, I wanted to talk to you about something that's come up with Dolores.
Yeah, you talked about Dolores several times in previous supervision sessions. It seems that, you really have a lot of good communication going on with her.
Yes, we do. And this brought me up a little short. I really didn't know how to respond. So, Dolores is looking for community. And I was telling Jesse about the church service I went to last week. It was enlightening. The sermon was amazing. And I just wanted to share the positive outcomes that I got out of that. Dolores overheard, and she approached me and asked if she could come to the service with me. And our work in the community is very good, and we do go places together. We've been to the food bank, we've been to the library, we've been to the mission. I just don't, is there a line here that we shouldn't be crossing?
Well, Gita, I just want to first say, thank you so much for always being attuned to, the needs of the individuals that you support. And thank you for your sensitivity around this, because it sounds like you really want to be able to respond to Dolores in a favorable way. And at the same time, you're expressing some legitimate concerns around, boundary issues and things of that nature. Now, if we were to kind of talk from an administrative point of view, because your role, is a navigator, I think, rules and regulations around your work in the community with someone you support might look different than if you were another staff member. So I think the issue here is, and as your supervisor, I'm more concerned about how you're feeling about the boundaries and maybe some of the different ways you can set this up to support Dolores, and at the same time, help to manage the expectations around, what her attending service would look like moving forward after the initial, visit. Like, for example, you can provide her the information and maybe see if, other participants of this program would like to attend. So maybe it could be a trip. I know you did that group on developing self-efficacy. So maybe setting it up as a goal where, Dolores's goal is to identify a spiritual program or a spiritual home that she feels comfortable in, but as part of her goal setting, maybe you can sort of assist her with getting there the first time. But after that, if it's developing community, that's something that she's going to be working on in her own time, which wouldn't necessarily include you after the first visit. So there are many different ways to set this up. And one more thing that I would say is that, I think transparency is really important, and to let people we're working with know that developing community is part of their goals. And, as peer navigators, our role is really to help to establish a linkage, if you will, between not knowing and knowing, or not being there and being there. So if you set it up that way, it might help to kind of, divide like where you can be involved and where your involvement might end. So those are just some ideas.
That's really helpful, Jonathan, because here in the suburbs, it's not like we're in the middle of New York City where there's 1,000 churches and synagogues and mosques that she could choose from. Here, where we're situated now, there really is only one of this denomination. But I think I really like the idea of a trip, maybe with me and another peer specialist. And I can, now that we've spoken, I can see how we can both be there, but not necessarily be there together. So
yeah. And it's almost like when we look for anything in life, whether it's socialization, a garment, a kitchen utensil, we're always looking for fit, and sometimes we have to try a few different things before it works. And I just also want to say that there are going to be many situations in life where we're in a situation where we have to navigate what we call a dual relationship. And we're it's live and let live. We're all there in the world. We all utilize certain resources. Some will be similar, and that's part of the socialization process, because I understand it's just as awkward for the peer specialist as it might be for the person who they're supporting to find themselves in the same space, like a supermarket or a laundromat or something. But it's just important that in developing self-efficacy, that person would feel like they are truly entitled and just as equal to be there as you or anyone else.
Well, I'm really glad that we can come out with a positive outcome for Dolores, because as I said, our work in the community is really doing well. And I think she is ready to dip her toe in the waters of a spiritual guidance or other activities that we have not yet done.
Great. So yes, let me know how that goes. I'm really excited because I can feel Dolores's excitement through you about this experience and your eagerness to support her and help her to really find this community.
Well, thank you. So let's turn briefly to the chat and see if anyone can tell us where. Maybe we could put the matrix up. It's the next slide. If anyone would like to share with us where they thought Jonathan as the supervisor was going with his assistance to me, Timothy.
And we're going to be looking at the chat, right, for people's responses.
Yes, unless someone wants to unmute.
Yes, we can have chat and verbal. Well, James says support, educate, and advocate. So while others are typing in, James, we're just inviting you. It's optional if you want to talk a little bit how that happened.
Well, this is James. I think that you really did build rapport with Gita, and educated on, educating on or reminding about what the core values of peer support are, and that we're there to support them finding their own community. And I just think that was a well laid out thing that y'all did. Thank you.
Thank you, James. Virginia, you said educate and advocate. Can you share your wisdom with us?
I just felt that as you were explaining to Gita about how to go about this, you were educating her on what she needed to know, because she wouldn't have come to you in the first place if she didn't know, okay, or already knew. And then you advocated for her to continue supporting Dolores in becoming a part of the community and figuring out her own way or her own path where she fits in. So yeah, that's why I said educate and advocate.
Well,
Or support,
you.
I'm sorry.
Yeah, thank you. Rita.
I think you went right into the beginning just by offering really positive feedback, and affirming that she had been already doing this work and the work in the community. And then you went into from support into educate, about sort of the different things to think about. I thought you did a really good job.
Thank you. Gita, what was the experience like for you in terms of, talking to the supervisor and, sort of feeling, how did you feel when you left the session? Like, what were your observations?
Well, I felt very good because I came in literally not knowing what to do. And not only did I not know what to do, but I was only looking at two options. Does she go with me or does she not go at all? So you were able to expand the horizon of possible interventions that could take place. I definitely appreciated being acknowledged for what I did do well, because when I get in these quandaries, I tend to lose sight of what's surrounding that and just nitpick right into that little dichotomy that I'm seeing and don't know what else to do. And you seemed to take me very seriously, which was supportive and helpful, and definitely educate by coaching on engagement. What I really appreciated were the suggestions of ways to incorporate her, the participants, Dolores, to incorporate both her attendance, my attendance, and in a way that would not embarrass or put a strain on either one of us. And I'm glad that you reminded me about meeting people in the laundromat or in the supermarket, because that's always, for me, I've always had this rule that, okay, if I see you in Walmart, I'm not going to approach you because it's nobody's business that you're receiving peer support. But if you approach me, that's great. And we can have that, quote, dual relationship. We can talk like two people in a supermarket about dinner. So yes, I felt much more comfortable and I felt safe and I felt that I was doing a good job, which I think is really where I want to leave supervision.
Yeah. Supervision is like a dialogue, as collaboration, as consultation, as opposed to necessarily a top down. Just very quickly, I just wanted to share this brief anecdote, if it is an anecdote. Just a little bit of disclosure that some years ago, in my own treatment process, I had seen someone who was called an extern. She was doing an externship. She was a psychologist, And she had a colleague who had run some group sessions that I attended, and I was a bit outspoken in the group sessions. And I ran into them at a Broadway play maybe a year or so later. And this is just an example of how, you know, helping professionals, if you will, could sometimes, you know, because, you know, a lot of us have dual roles, couldn't put our foot in our mouth, because when I went up to say hello to them, one of them said to me, "Oh, I remember you. You had quite a presence." And it's interesting how when we have a label on us, like a participant or consumer or peer, and we behave in a way that is, when we're outspoken, when we're informed or informative, that it's pathologized. And she says, "Oh, you had such a presence." And it let me know that compassion is a two-way street, that instead of feeling marginalized by this person higher on the hierarchy than I at the time, that I could have some compassion, that like they didn't really know what to say. Because oftentimes people who are supporting us, whether they're a peer supporter or a nurse or a social worker, they may see us at a time in our journey that, you know, our strengths may not be as visible. And then when they are, it's like people don't always know what to say. So I've learned to try to kind of take a step back and see that person's having a hard time with change. So anyway, neither here nor there. So Raymond, you have something in the chat as well. You said support. So did you want to speak to that a little bit before we go into the breakout room activity?
Sure. Thank you. You know, I don't know if I have much more to add than what's already been said, but the thing that struck me is how you refrained in speaking with Gita about, well, here's what I think you should do, or giving direct advice. It was very much like the work I do with my peers. It's, well, have you thought about this? What about that? You know, and I thought that really opened up the conversation and showed a lot of respect for, as other people have said, how Gita, you know, is providing her support to this participant. So I'm all about support. Thanks.
All right, thank you very much. So we're gonna, and thank you, Rita, for the time check. We're gonna move into, if we can go to the next slide.
So yeah, everybody's just going to read the scenario in the chat, and then using the 5 critical functions, discuss how you might consult with Mary Lee about her request to attend a conference.
So it looks like we have 26 people here, which is very close to the number that I noticed before we went into breakout rooms. So Rita and Gita, do we want to invite a volunteer to read the supervision situation first, and then just kind of invite people to talk about their process?
I will.
Sure, go ahead.
Okay. So as I was looking at this, I came up with, first of all, that I would acknowledge that Mary Lee is interested in going to this conference. And the next thing it was coming into being concerning. I'm not going to probably say this like you were saying it, but anyways, I just want to acknowledge, let her know that I'm hearing her and her interest, which I think is really awesome, that she finds an interest in going to the conference. But the other thing that I'm concerned about is because of the backload that is of paperwork that needs to be reviewed. And understanding that you just came back from a managed care summit. So the next one I put down as evaluate, because let's evaluate the situation first. Is it possible that let's look over what your workload is, And let's see if possibly we could reach out to the co-workers to see if something that they're willing to help you with so that you can attend the conference, or is this something that definitely is something that you need to take care of yourself? And again, because I think it's really important as a peer specialist to attend these conferences. So that's what I got.
Oh, thank you, Deborah. Thank you so much. You just jumped right in there. I appreciate that. We appreciate that. Gita, Rita, did you have any feedback, or you want to sort of invite others to share about their dialogue on this? Excited to hear.
Yeah, well, first I wanted to thank, is it Deborah or Deborah?
Either one.
I'm coming as someone with an unusual name as well. But yeah, I think she really captured the many moving parts that you could vacillate on, but you have to make a decision, you know, and I think right up front, acknowledging her interest in further training and education is really, it would be a good hit for my self-esteem.
Yeah.
To this be taken as professional self-development rather than just 4 days off work.
Mhm.
So I think that was very supportive.
Yep. Thanks.
I was just going to say, it might be interesting to ask some questions, you know. We were actually talking in a meeting just before we started this webinar about required, you know, training versus the professional development training. So we were having this conversation right before. And I think it's really important to acknowledge that people don't always want to go to those required trainings, but they're required. So this is an instance where they had to go to a required training. And now they have a training that they want to go to, but the reason they're behind in their work is because of the required training. So it's having that conversation about, well, you know, let's take some personal responsibility. How do we make sure that the work gets done and that you go for a training that is going to be for professional development, you know, and, you know, something that you really want to do. So it's working through all of that. And I think you pretty much were saying that. It might have just been a matter of asking the questions for them to come to the conclusion of what they needed to do in order to be able to take advantage of this opportunity.
And Rita, this is James, I agree. Because the 3-day managed care summit, in a sense, has nothing to do with I mean, I know she needs that required training, but a peer-specific training should always be encouraged. But again, figuring out a way to take care of the backlog, you know, in order to make the time for that. I think one of the best things is to always encourage peer trainings. You know, I think that's the only way we're going to grow the workforce and get the experienced and skilled people that we need.
I agree.
So others in the breakout room, what came up for you in terms of discussing the scenario or the situation? We are very excited to hear. And just unmute yourself and jump right in.
This is Virginia. I keep going back to where it says, as Mary Lou's supervisor, you feel reasonably concerned. and I keep going back to that sentence. So yeah, I in our breakout room, I said I would have to think about this before I gave an answer. I'd have to go talk to somebody else too. So,
you know, it's interesting that you say that, because in this meeting that Rita has already mentioned, we talked about the need to consult. Wait, I'm trying to remember exactly how this came up, but the need to make sure that training is relevant and meaningful. And we had a long talk about, well, is this meaningful and in what context? And like James had said, the managed care summit is, you know, it's meaningful because you work in managed care, but does it address the person's desire for professional development and training? So
yeah, maybe we can hear from one or two more, and then Rita had a really fun idea that you know, she can talk to us about. And there's a lot of experienced supervisors here, so we're really eager to see if any of this makes sense to you, if we're on the right track.
So this is Juliana from Gallup, New Mexico. And I was just thinking that, you know, this individual's desire to connect with other peer support specialists, you know, is a really valid concern that can really affect morale. And so wanting to support that, but then also recognizing that the forensic nature of this particular training, the fact that she was just at a summit, that maybe that's not the best way to plug her in, and that maybe looking for some other training or conference that she can attend in the future, where it's something that she can sort of look forward to while she gets caught up on her paperwork, and know that there's some connection and support coming in the future. Because I think that's, you know, we don't want to just dismiss the fact that she needs that, but also, you know, really help her get the most out of those experiences, because obviously she's also got to be doing her work in between those kinds of trainings and conferences, and making sure that she's staying on top of her responsibilities.
It reminds me a little bit of what Deborah said earlier about like the evaluate column or function, in terms of, well, there's a negotiation that's going on, and there's also managing of expectations, which also comes up.
Can I ask a question? This is Virginia again. In the very first sentence, it says Mary Lou has been working for a managed care organization for 9 months. Was there a reason why you would have put that in the scenario?
Just as another data point in helping with the assessment of the request and the evaluation. Okay. You know, I think different supervisors can go in different directions. Some might feel as a newer employee, as in under a year, maybe training would be more of a priority, and other supervisors might feel differently. And I think, you know, it can also speak to what Gita made the distinction before about, you know, rural and urban and suburban, that, you know, maybe in a rural area where there's not as much interaction or likelihood that someone's going to encounter other peer specialists, that might guide the decision more.
Yes.
Do you know what I'm saying? So it's another data point.
Okay.
If that makes sense. Sometimes we write things in that seem arbitrary, but they're really not. Rita, did you wanted to do something about, you know, speak to what people put in the chat at the beginning?
Yeah, just a real quick. It's interesting that we kind of spoke to, you know, our favorite supervisor, what that was like. And I wondered if this would happen, and it sort of did. You know, you could sort of see the echoing and reflection of, are the 5 functions reflected in what you all said about your favorite supervisor? So understanding supportive is one of them. Caring, knowledgeable, did not micromanage, listener and cared about what kind of input I had. That's kind of the supportive function. Transparent, fair, role model. So that's kind of a combination of educative and I think probably advocacy too. Kind, accepting role model, supportive, mentorship and support, supportive, leading by example. So these all, what's interesting about the 5 functions that we've talked about often is that the 5 functions are not silos. Many of the things when we talk about what really good supervision is will cross the boundaries of the five functions, but the 5 functions give us a place to really explore in greater depth the kind of supervision relationship that you have with a peer supporter. And I think that's really important. So just going through good, clear communication, strength-based, compassionate, no nonsense, while taking into consideration my unique personhood, willing to help problem solve, information sharing and explaining the whys, being a good listener, rewarding ability to assist with honing skills that are not as strong, giving praise, mentorship, open, supportive, ethical, encouraging and flexible, really cared about the people we serve. I thought that was really a nice summary of what really good supervision is about. And I just wanted to capture that and reflect it back to you from the very beginning before we talked about the 5 functions, now that we've talked about the 5 functions and what good supervision looks like. Next slide, please. So those are the 5 functions. Next slide. And I gave you a head start on this, but based on what you learned today, are there any other qualities you would look for in a supervisor? Go ahead and type your answers in the chat.
It does look like a really good list.
So you did it in the beginning. But based on anything that you've learned since then, since this particular presentation, otherwise we can just go home and just give you the cup.
Yeah, we've preached to the choir, So.
Yeah, we don't always get to talk to a room full of supervisors. It's very interesting. Yeah.
Yeah. Now we want to come to Texas and sit down with you in a circle.
Yay.
I miss those.
Yeah, I do too.
Come on.
Gita, our last one was in San Diego, wasn't it?
Wow. Yeah. Yeah. I believe that was NAPS.
2.5 years ago.
Hard to believe. I think we can go on to the last slide so we can wrap up. But if you can think of other qualities of supervision, go ahead and put them in the chat. If you have any questions for any of us, go ahead and ask.
Thank you.
Thank you.
And I think next is just contact information.
Yes, and please don't leave yet. We have a survey link we need to send you.
Oh, co-reflection. Do we have someone trained in emotional CPR?
Or intentional peer support?
Oh, all my trainings are a jumble in my head.
Yeah, IPS is where co-reflection comes from.
Yes, I was thinking the same thing. What a nice slide.
Yes, and we also wanted to just give you you all an advanced notice that we're coming out with a book soon. It's a fundraiser for the National Association of Peer Supporters, and we've gone through many of the last 5 years of presentations and invited presenters to give narratives, and we will be probably publishing the book by late summer, early fall, hopefully in time for the next NAPS conference. But here's how you can reach us, and here's how you can also reach the National Association of Peer Supporters. And on that bottom link, that's a link to the National Practice Guidelines for peer specialists and supervisors that you can use as an additional tool for self-assessment of your own supervision or providing supervision to others, just understanding the role of the supervisor in relation to the practice guidelines.
Yes. We want to thank Jesse and Jennifer and
Yes.
this project for inviting us back. And Rita and Gita, two really dear colleagues and friends that I really enjoy working with. And it's been a good afternoon. Like I said, it would be nice to be in a circle. And,
Yeah.
granola bars and apple juice, but maybe that's to come. And we just thank you for being here. You've left us wanting more.
Thank you, Jonathan. It's always a pleasure to work with you and Gita. It's been new for me, but this has been a lot of fun. I really appreciate it. And please do fill out that survey in the chat.
Thank you so much, Rita, Jonathan, and Gita. We at the MHTTC want to also thank you all for being here, especially our presenters. And we do ask again that you fill out our survey. It helps us with our funding to continue to put on really awesome events like this. I promise it's really short. Yes, Kitty. But please fill out the survey. We also have a newsletter that you can sign up for on our website if you would like to get information on when new events like this are going to happen. We will have the recording for this up in the next couple of weeks, most likely, and we will be sending out the CEU certificates as soon as we possibly can. You should see them within a week at the latest. Thank you all for being here.
Thank
Thank you,
you.
Jesse and Jennifer. Thank you both.
Yes.
Yes, thank you so much.